We are now. Welcome, 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 welcome to our Healthy Tuesdays. Y'all, we've had some phenomenal guests on our segments, and today is no different. We have Aquita and Terrica from Mind, and I hope I don't mess this up, Melanin and Medicine. Did I get it right, y'all?
Got it.
I got it right. I've been practicing all day because I get tongue-tied. And so thank you, ladies, for coming onto the show. We are grateful to have you here. Thank you for sharing just your gift, your talent, your knowledge, and your influence. And so just to give a little bit, they are nurse practitioners who are passionate about educating the community on chronic conditions that plague us. Minorities deal with such deep issues. We deal with high blood pressure. Just the fact that, we have low income communities that can't afford a lot of the healthier things. And so I'm grateful for these two ladies that have come in and are ready to talk with us. Just give us a little bit about yourselves. Tell us what got you started in this.
Do you want to go? You want me to
Go.
Specifically about ourselves individually, or just about
a little bit of both? What started you in medicine, and then tell us how you guys got together to do this amazing work that you do.
Okay, so I am an adult gerontology nurse practitioner. I've been practicing, I guess, a little over 2.5 years. Started my career as an RN at UAB. So I've graduated from the University of Alabama twice with my bachelor's and my master's degree. And really, in terms of the podcast, and Terrica can tell her version of it too, but we basically have very similar stories in that we both kind of envision ourselves doing something more than just working as nurse practitioners, more than just being in the clinic setting. We wanted to go out into the community and educate not just patients or individuals about health, but we really wanted to help people, nursing students and people who wanted to go into the medical field, basically get them to a point that we got to, because we felt like we didn't necessarily have all the steps laid out in front of us. And so we wanted to kind of be trailblazers in creating the steps for other people. And so that's kind of a very small synopsis of it. And realizing that we both wanted that same thing. So basically, I had this vision, and I felt like God was speaking to me and saying, you need to do this. This is what you need to do. It's like, okay, well, how do I get there? Because I don't know. And one day, Terrica, and she and I have known each other for several years now, but she actually posted on Instagram, and she was basically introducing herself as a nurse practitioner. It was during Nurse Practitioners Week. And I literally saw her post on Instagram and was just encouraging her, like, get it, girl. Like, I'm so proud of you. And literally this voice, it was so audible, said, text her and tell her everything that you want to do. And I said, huh? Want to do what? Come again? And so I randomly texted her and I was like, hey, so something told me to tell you that this is what I want to do. Like, I really feel led to explain this to you and share my vision with you. And I don't share this with anyone. And she was like, that's so crazy, because I've been praying and trying to figure out what my next step was. Like, I know what the end goal looks like, but I didn't know what the next step was to do it. And so that's ultimately how we kind of started collaborating and literally just writing out everything that we're passionate about. We're passionate about educating people. We're passionate about helping people get to the next step of nursing and nurse practitioners. We're passionate about medicine. We're passionate about being African-American and some of the things that plague us as being African-Americans, being women, the challenges that we face. And we just literally would write down everything. It's like, okay, so how do we bring it all together? And so the pandemic hit, and just like, well, let's start with the podcast. And so, I mean, that's kind of my story.
Awesome. Terrica, come on, girl, chime in.
That was beautiful, first of all.
She was tap dancing and went, ta-da!
Oh, okay. And I love that, you know, you're going through all of that, you know, what you thought and how we came up with this. And it was during Nurse Practitioner Week. And this is actually
Nurse Practitioners Week.
And so to see us like
actually me emotional.
Yeah, to see us living this out is beautiful. So
oh my gosh.
But yes, my name is Terrica, and I am a doctorally prepared nurse practitioner. I'm certified in both family practice as well as adult gerontology acute care. Currently, I work in a family practice urgent care hybrid model. So I do a little bit of both currently. And so, like Aquita was mentioning, I've always been passionate, just like she's always been passionate, just about healthcare. We're young, we're Black, and I find that, you know, there are so many people who are in our or wanting to be in the shoes and wanting to walk the same path, but may not necessarily know the steps to get there. And so I've gotten a lot of questions on how did you do it? What school did you go to? How did you get in? And so all of those questions, I'm like, man, I really like want to help lead other people to this path.
Wow,
Also, you know, at a young age so that they can do it too and to know that they can do it as well. I've always wanted to be in healthcare, specifically since my mom, she was poisoned when I was a child. So I had to like grow up seeing her, seeing the nurses and doctors like care for her, seeing her in the ICU, all of that. I remember that vividly. Wow. And so that really, you know, I would say started my love for healthcare, essentially. But I remember posting, like Aquita mentioned, on Instagram and just talking about Nurse Practitioners Week and just things that we do as a nurse practitioner. And yeah, she hit me up in a text message and was like, I think God is telling me, like, you know, God's telling me that we're supposed to be doing more. We're supposed to be doing something else. And I agree because I had been praying and trying to seek what it is that I'm ultimately supposed to be doing. Like my purpose. You always want to know, like, what is your purpose in life?
Wow.
And it was crazy because she was like the answer to the prayer because, you know, we've literally been collaborating since then, and we have been afforded so many opportunities already just to speak and to help to, you know, mentor people. And we've gotten really, really good responses from what we're doing. And I'm just thankful and grateful that to be living in my purpose.
Awesome. I keep hearing in my ear, ladies, go ahead and sing. God's trying to tell you something. It is beautiful because God will, it's amazing how, you know, y'all are in this space where y'all are simply just encouraging each other, and God talked to y'all like simultaneously and say, okay, now how he puts people together. And I find that just so amazing. And look at the great work that y'all are doing. Y'all are passionate about it. You love what you do. And that is just awesome to me. I'm just excited. I got goosebumps. So let's talk a little bit about, you mentioned COVID, and you know, my saying, COVID ain't been kind to
not nobody.
You know, being on this end of it, of nonprofit, we have seen so much happen from the health aspect, the financial aspect, the, you know, just stress and strain. And, you know, it's been really challenging for families this year. And I work in a predominantly African-American community. We serve everybody. We have had all cultures come to us for assistance. And so, but the neighborhoods that we are predominantly working in, they're, you know, predominantly African-American. And so I understand when you're talking about the culture of it all, it's very important. So I want to ask you ladies a question. What, being that this year is the year of COVID and you doing the work that you do, what challenges have you seen, you know, during this pandemic, especially with people who have pre-existing conditions and things that they need to really think about and do differently?
Do you want to answer that, or?
Sure.
Okay. Yeah.
So, like I mentioned, I work in a family practice and urgent care model. So we do actually see walk-in patients. For me, and I think Aquita probably could attest to this too, we have seen a lot of depression and
Anxiety. Yes.
unreal.
Unreal, like unprecedented.
And it's literally like I am seeing young patients, 20s, mid 20s or so, who are literally like, oh, I lost my job. I don't know how I'm going to pay for my apartment. I don't know how I'm going to pay for anything. And I have patients who are just panicking in a sense, just due to what COVID has done for them financially, or, and they just don't know how they're going to make ends meet. Outside of that, those same patients also are now experiencing cardiovascular issues. So they're experiencing chest pain. I've seen that a lot, which you don't even expect or anticipate to see that in someone who's, early 20s or mid 20s or even 30s. You don't really see that. And so I get that a lot. Patients whose chests are just now hurting. They're having trouble breathing, and all of that probably is due to more so anxiety related, but it's still an issue that's going on.
Yeah. And even myself, like we have to stay up to date on COVID and everything that's going on with it. I get chest pain and shortness of breath just thinking about it. And so it's so crazy how really understanding that your mental health really affects your physical health too. And so it can be manifested, all these symptoms that you have, anxiety and being stressed out, being depressed, they manifest as physical symptoms, such as the patients who come in for the chest pain, the shortness of breath, just random, the upset stomach. I've had diarrhea for several days now. And, a lot of times it's really just anxiety and stress manifesting itself in the physical form. In terms of the pre-existing conditions, really and truly, for me, as it relates to like diabetes, hypertension, those type of things, I found that my patients who have these chronic conditions, which would be the hypertension, the diabetes, those type of things, a lot of that is managed based off of exercise and diet. And so our patients haven't been able to go out the way that they're normally able to. They haven't been able to exercise the way they need to. I know myself personally, I've eaten a lot of food during this quarantine.
I've been trying. I don't eat a lot, but anybody that know me know I don't eat a lot. But I mean, your girl, I'm just saying.
Yes. And their diabetes, look, their fasted blood sugar or their blood sugars show it, and it really starts affecting their chronic illnesses in that way. Stress in itself can, raise your blood sugar levels. It can raise your blood pressure levels. So seeing patients and just with this uncontrolled hypertension and having to give them multiple different medications to treat it. So
it's amazing to hear that, because not only are people having to worry about, being infected with COVID themselves, it's just all this other stuff that's compounding, the stress, the anxiety, and then having to, I can't go walking like I want to. I can't do this like I want to, because, it's just so, you have to protect yourselves if you have these pre-existing conditions. And if you do have like lung problems or something like that, the mask, it's restricting your breathing. So you really can't go out and do what you want to do as far as walking and things like that. And so you all have you ladies have like a presentation, and this is going to kind of coincide with some of the additional questions I wanted to ask y'all. So y'all have the floor on sharing what you need to share with your presentation. And I want to get into some more of these things, because, not only have we dealt with COVID since, I want to say, basically the winter of last year, we just didn't know what it was. that December, that I've heard as early as October last year, and we didn't know what it was, and all the way until now. And so I remember back in January, I had some symptoms, and it was undiagnosable. I went to the doctor. They did a flu test. They did a pneumonia test. All of that came back negative. But I was experiencing respiratory issues, what they thought was just a basic sinus infection, and it turned into, it got in my chest, and I ended up taking 3 breathing treatments. They still didn't give me a diagnosis. They didn't know anything about COVID back in January, February. I don't think it really came to light until like March, and so I had to take 3, like I was on 3 breathing treatments a day for about 2 weeks. I have my own nebulizer, my meds. I had taken steroids, like I want to say for about a month, and then they had me on my 2 different doctors put me on antibiotics. And so my asthma doctor took me off of all of those antibiotics because they said that really wouldn't do anything. But it was the steroids and the breathing treatments that was helping me. And so, which made me feel some kind of way, because again, I'm like, okay, you telling me what to do for it, but you can't tell me what it is.
What it is.
And so I lost my taste, my sense of taste and my sense of smell. Wow. I did. I lost it for about 6 weeks. In fact, I was sick from the beginning of January till I can remember when I got my taste and smell back. And I was around people. They didn't tell me not to be around anybody, none of that. Self-isolate, nothing. And so we was at a birthday dinner for my mom, and I tasted some food, and I said, "Oh, this food tastes good." And my husband looked at me. He said, "You can taste." And then I paused. I said, "I can smell too." But all of the worst symptoms had been gone. Yeah. So, as I was learning more about COVID, I like I said, I never got a diagnosis, but a lot of the symptoms that went along with it, even the diarrhea, I had that as well. So a lot of the symptoms that have been described in our medical world, I did have those challenges, the fever, all of that. So I don't know again if that's what it was, but that's my experience, and I'm sharing it for educational purposes.
You can go and get the antibody testing for it to see if you've been exposed.
It's gonna show up this late in the game.
That was in January, so yeah. We still don't know so much about COVID, honestly. Yeah. So you should, in theory, have the antibodies. You may not necessarily have the immunity that you would have had when you initially were exposed to it, but your body should still, show the antibodies.
Well, your girl done update, like I said, I up my game on my vitamins. I'm taking vitamin D, vitamin B12, zinc. I'm taking all my calcium, all of that faithfully every day. Yeah. So y'all have this presentation. Y'all got it pulled up, and we're gonna share it.
It's actually just pointers that we have. So it's not like a true physical or presentation that we would show, but it's just different pointers that we have on how to stay safe during the flu and COVID. Flu and COVID season. And most of the guidelines are pretty much based off of the CDC. So you can find these guidelines on cdc.org or cdc.gov, excuse me, for anyone who's listening. And I can start off.
Go ahead.
There's just about 10 different things that the listeners can do to prevent flu and COVID. The biggest thing, we hear it everywhere we go, it's going to be wash your hands for 30 seconds, sing happy birthday, sing old MacDonald had a farm. Planet Fitness says, sing the chorus to your favorite song, something they say, but wash your hands with soap, with water, as often as you possibly can, all the time. Use hand sanitizer with the alcohol base whenever you don't have access to washing your hands. But really and truly, washing your hands is going to be the biggest thing that you can do to prevent the spread of it, because we touch so many different things with our hands. We touch doors, literally our cell phones, and we put it up to our face. We put our cell phones everywhere. So yeah. Washing your hands is a really big one.
That's a huge one. Also, the other thing that you want to make sure that you're doing is covering your mouth, especially if you're going to sneeze, you're going to cough, blow your nose, anything like that. You want to just cover that. Try to sneeze into your elbow if possible. And we are all wearing masks, or we should be wearing masks. think I went into Walmart today and there's still without masks, but it's just very important when you are wearing your mask, make sure it covers your nose as well. Like, it should not just be right above your lip. And that's very, very important, because if you do sneeze accidentally, just particles, something may come out of your nose, who knows? But, you're releasing that into the air for other people to breathe. And that's not cool. So
right.
Make sure you're doing that and avoid touching your face if you can at all times.
Awesome.
Another thing is you're gonna want to avoid coming in close contact with people who are sick, because this is flu season. I can't talk right now. This is flu season, but we are also battling a pandemic. We're battling sinusitis. We're battling strep throat. We're battling all of these different things, and truthfully, they all kind of have a lot of the same symptoms. And so you can't just say, oh, I'm sure you just have a cold, because you don't know, because the symptoms of COVID, they range in such severity and such mildness that you really don't know. And so the best bet is to just stay away from people who are sick. Even if you're doing your social distancing, it's still very important that you just don't come into contact with those people as best as you can.
Absolutely.
So
go ahead.
I have a question about the social distancing.
Okay. Let's hear it.
So, you hear a lot of people say, well, social distancing, 6 feet apart, that's the recommended scale for people to stay apart from each other. And so as I think about that, I have gone in spaces where that has not been so. They have the little circles, and they're really more like 2 feet apart. And so, when we truly say 6 feet, we're talking about measuring tape, this space to this space, and that is how far apart you need to be, right?
Should be.
So when we have people that we live with, does that pertain to them too, or is it okay for husband and wife to be together in the same space, and then the person who's not known to them 6 feet apart? So what's the clarity on that? Because I've gotten questions about that, and I'm like, 6 feet apart is 6 feet apart.
Black and white. You want to say, give me 6 feet, back up. And so I know that we've been telling people, so the person that you live in a household with, you're kind of already being exposed to their atmosphere. You guys are already kind of sharing the same germs. We're all colonized with our own subset of germs that we have. And so unless your significant other, your children, someone has tested positive for it, it wouldn't be, you wouldn't need to keep that distance within your household, because you guys are already sharing the same refrigerator. You're sharing that. So if, that it would kind of be redundant, I guess, would be the best way to explain staying 6 feet away from the people that you cohabitate with. Would you agree, Terrica?
I agree. Absolutely.
Okay.
Absolutely.
Okay, that was very good, because I have gotten questions. I'm like, look, 6 feet apart.
6 feet.
Do the foot method, heel toe.
And just before I get to this next point as well, I do think some businesses have become just a little relaxed. Yeah, in the sense, and so they are not following the guidelines like they should be. If you notice, even I went to Walmart today because I had to get some groceries. But even now, you don't have to go in one door now and come out the other.
Really?
Yeah, like it's just back like normal.
How it was before.
So I do think businesses have become a little bit more relaxed.
Right. And people too, because I'm very cautious, because I'm just cognizant of what's going on. We're around it all the time. But even people, I'll feel them in line behind me, like, why can I feel you breathing on me, sir? Back up. Back it up.
Give me my 6 feet.
Even people are becoming more lax, and not necessarily being an adequate amount of space between them and the next stranger in line, and those type of things.
Right. So moving on to our next point, we also want to encourage you guys to just make sure you're staying active. According to the American Heart Association, they do recommend at least 150 minutes per week. If you break it down, that's about 30 minutes a day for about 5 days out of the week, if you can just get up and, and move. I tell my patients personally, it doesn't all have to be at the same time. Like if you want to do a 15-minute jog in the morning and a 15-minute jog in the evening, that's your 30 minutes per day. The goal is just to get you moving and just to make sure that you are going to be capable and compliant with doing that, you know? So I never want to tell my patients, oh yeah, you got to do an hour today, because some people can't do that physically, you know? So, you know, I love to try to break it down about 30 minutes on 5 days out of the week if you can.
Yeah. And we've found just dealing with patients, dealing with people that really and truly just can't walk or can't jog for 30 minutes. It's easier when you have this major goal and you break it down into smaller tasks to conquer those things. And it's better for even the listeners who are like, I cannot even do 15. Okay, do 5 every couple of hours, especially if you're quarantining at home anyway. Walk around your house for 5 minutes or do some type of jumping jacks or something for 2 or 3 minutes and conquer those smaller goals. Another thing that's just as important as getting exercise is getting plenty of sleep. Our body actually does its best work when we're sleeping, when we're resting, so that it can do what it needs to do, so that our cells can do what they need to do. You're much more likely to develop the common cold and other viruses when you're sleep deprived, because your body, its immune system just isn't beefed up the way that it needs to protect you from developing even something as simple as the common cold. So making sure that you're getting enough sleep. So here's the thing. Most people think that they need just 5 hours of sleep. They're like, oh, 5 hours and I'm good. However, the CDC recommends that adults get at least 7 to 9 hours of sleep on average. And so making sure that you're hitting that time mark. I need about 10 hours to function personally.
Well, for me,
I need, 9, 10, 11, 12. Yeah, sleep is a really big one.
Yes. Also manage your stress, guys. I know we touched briefly on the surface about how much anxiety we're seeing, how much depression we're seeing. So it's very, very important that you manage your stress. Find something that you enjoy, okay? Something that you can just break away from other people. Even if you have to take a break from social media for just a little bit, break away and find something.
In the news.
Yes. Yeah, find something that you truly enjoy, okay? You can also find ways to manage your stress better from the CDC as well, and also on helpguide.org.
Yeah. Drink plenty of water, not sweet tea, because we're in Alabama. We love our sweet tea, not our sodas, our red Kool-Aid. Plenty of water. Water is going to keep you hydrated, keep your cells hydrated. And it's really another integral part of making sure that your immune system is functioning the way that it needs to. So staying hydrated, which is especially important when it was warmer outside, because, we're sweating and constantly losing fluid that way. But even here, now that it's cold outside, drinking plenty of water is really, really, really key to keeping your immune system where it needs to be.
And also make sure you maintain your diet,
Ooh.
A good diet. So, you eat good foods, nutritious foods. You want to eat, there's like food plate. Yeah, food plate.
I think it's foodplate.gov.
Foodplate.gov is good because it tells you what your plate should look like every time you eat. Okay. And you want to kind of follow that just to make sure that you're having all of the nutrients that your body needs. Vitamin C is going to be very good. We talked about supplements, or maybe we haven't. We will talk about some supplements.
Yeah.
But, maintain your immune system, essentially. So lots and lots and lots of vitamin C. I always do orange juice. I do vitamin C tablets. Yes. And I do the oranges, okay? Like, I'm stopped.
any citrus fruit is going to be really good to give you some vitamin C. So tangerines, grapefruits. I don't like grapefruits, but oranges, cuties, all of them are really good and high in vitamin C. Get the flu shot. So most people, they're kind of on the fence about the flu shot. And in the past, I'm like, okay, I kind of understand, because even when I get my flu shot, it makes me feel really bad for a few days. But if there is ever a time for it to be important to get the flu shot, it's right now, because we're already battling something that is so grand that does have a lot of the symptoms of the flu. The flu does hospitalize a lot of people every year, and a lot of people do die from the flu, but now we have to contend with the coronavirus and hospitalizing those patients and the projected deaths that are associated with those infections as well. And so we really don't want to overwhelm our healthcare system by battling two different, very lethal conditions. So it's very important that you guys are getting your flu shots. If you're over the age of 65, you're getting your pneumonia vaccinations, and just making sure you're staying up to date on everything.
Awesome, awesome, awesome. All right, so as we get ready to conclude, what other supplements, I know we're talking vitamin C. There's been mixed, media about vitamin D, vitamin D3, just so many different vitamins. And, y'all heard me say I've upped my vitamin game. Are there any other supplements that you would recommend?
Yes, definitely. So I definitely recommend zinc. Number one. I also recommend elderberry, alongside with the vitamin C, of course. That has kind of been one of the cocktails that providers have been giving to people or educating people on, especially in the hospital. So I try to recommend that to patients. So elderberry, zinc, and the vitamin C. And then of course, just multivitamin too, just so that you kind of knock out
a lot of things.
Other
yes,
nutrients.
Yes, there are actually elderberry gummies that they make, and they are delicious. And they also make the gummies for multivitamins. And like Terrica said, just eating a one a day of some sort, some type of gummy. I take a multivitamin that's a gummy every day because I'm not going to swallow that big horse pill. I understand that it's disgusting. And so I get my gummies. And when I was a kid, I did Flintstones. And so you can even get those who are listening who have children, give them those Flintstone multivitamins. Yes. And of course, don't make any changes to your medication regimen without first consulting your primary care physician.
Awesome, awesome, awesome. So as we get ready to wrap up a little bit, we've talked about, the exercise, the supplements, we talked about the 6 feet apart. What other recommendations would you give, or give me your top 3 key points that you would take away from this, whether it be a health nugget, a spiritual nugget, just give me what those little nuggets are, because we said that this team together is divine intervention and passion. So give me those last 2 to 3 top nuggets.
So go ahead.
I'm gonna keep it short and sweet. Short and sweet. And I'm gonna say, drink your water, wash your hands, and give me 6 feet. So those are gonna be my words of wisdom. Drink your water, wash your hands, and keep it at 6 feet. I'll keep it short and simple.
Don't have little icons across the t-shirt.
Yeah. And so my 3 would probably be take your vitamins for sure. If you believe in God or whoever you believe in, that's who you should look to. Okay.
Yeah.
Pray.
That's good.
Pray.
That's good. That's good.
Pray. And just to, even if you are affected with COVID, just know, you want to pray for strength, pray for, support, just pray for all of those types of things. And then lastly, follow directions and be obedient. Because there's so many people who, we're giving you the guidelines, we're giving you the recommendations, and some people just refuse to do it.
Right.
And I think that some people are, could be selfish in a sense because they're like, oh, I'm fine, but it's not about you. What about the 80-year-old who you don't even know someone has come in contact with, and you might have given them, the virus. So that would be my top 3.
I think that transcends even just medical advice, like be obedient to what you feel like you're spiritually being led to do too. So that can be our wrap up together, be spiritually obedient too, because that's how we are here. That's how we are. So that can be ours that we share.
I love it. I appreciate you, ladies. Thank you for this segment. And you know, a lot of people don't believe, you know, you have those people that are in denial. Is it something made up? Is it something this? Is it something that? Look, don't try to figure it out. Don't try to figure it out.
Yeah.
Just do what you're supposed to do. Be obedient.
Like that's it.
So, ladies and gentlemen, you heard it from the medical experts or professionals, Terrica and Aquita. Tell them about how they can log onto your podcast if they want to listen to it.
Yay. So guys, if you would like to check us out, you can tune into our podcast, which is available on all of the major platforms, including Apple Music, Google, Spotify, Apple Podcasts, Google, Spotify. So just check us out there. And you can also follow us on Instagram at Mind, Melanin, and Medicine.
Oh, she did it so smooth. I messed it up earlier. So
she does it. So look, anytime that we have to say it or close, I'm like, Terrica, you got it? You want to do it? I get tongue twisted.
All right, so that's our Healthy Tuesdays. This week, it is a wrap. Thank you, ladies, for sharing.
Thank you for having us.
We want you to come back now.
Yes, this was so good. This was so good.
I loved it.
Awesome. So we'll see you guys next time.